and welcome to Sureena Speaks. And in this video, I'm going to go through how to conduct an MUR. So first and foremost, what is an MUR? Well, MUR stands for a medicine use review, and it's about having a chat with our patients and seeing if they know why they're taking the medication and seeing how they're taking the medication. In my own experience, I've seen that either patients are taking their medication incorrectly. So for example, if they're supposed to be taking it before food, they're actually taking it after food or vice versa, or that they don't actually know which medicine is for which condition. So for example, they might be on a diabetic tablet and a cholesterol tablet, but they wouldn't be able to tell you which is their diabetic tablet or which is their cholesterol tablet. So MURs, those that are eligible to have MURs is someone who's been a regular patient of yours for the last 3 months, or a regular patient of the pharmacy in the last 3 months, and they've been on at least two regular medicines. Now, the only exception to this rule is a patient who is on a high-risk medication, which I will talk about in more detail a little bit later on. But if a person is, say, on a long-term diuretic, which counts as a high-risk medication, so say they've been on furosemide for the last 5 months and they don't take any other regular medicines, they are still eligible for an MUR. As opposed to someone who's, say, on amlodipine for their blood pressure, which they might have been on for years and years, if they don't take any other regular medication, then they're not eligible for an MUR. So MURs can be broken into two categories, targeted and non-targeted. With targeted, we can actually break it down into further sections. So you have those that have cardiovascular disease, those that have respiratory disease, the high-risk medications, which I mentioned a little bit earlier, and also patients who have been recently discharged from hospital. So a patient who has cardiovascular disease, they must be taking at least 4 or more regular medicines, and of which one of these is either a diabetic tablet, a tablet for thyroid, so for example levothyroxine, or any medicine that is in chapter 2 of the BNF, so for cardiovascular disease. A patient who has respiratory disease, they must be taking regular medicine to either treat their asthma or COPD. And a patient who has been recently discharged from hospital and has had a change to their medicines, ideally you want to do an MUR on them within 4 weeks of them being discharged from hospital. And our high-risk medicines. So those that are included in high-risk medicines are, for example, NSAIDs. So if someone's taking long-term aspirin, for example, antiplatelets, anticoagulants, and diuretics. And then also you have your non-targeted. So essentially non-targeted are medicines that are outside the targeted category. So for example, if you have somebody who's taking sertraline and mirtazapine and they've been on them for more than 3 months and they're a regular patient of yours for more than 3 months, then they would be in the non-targeted category. So community pharmacies, the MURs that they conduct, at least 70% of them has to be targeted. They have to fall within the targeted category. Now, the role play that you're about to see in a moment, I must disclose it is completely and utterly fictional. Anything that is mentioned in there is completely made up, so there's no privacy or confidentiality being broken at all. It's utterly made up. And what I really want you to take away from it is actually how I lay out and structure my MURs, rather than some of the clinical context that is said during the MUR. Now, every pharmacist has their own style and their own way of doing MURs, so if you're a pharmacist watching this and you have any additional hints or tips, please write them in the comments box below, because I'm sure our pre-regs, our pharmacy students, or even other pharmacists will want to learn from you too. So let's get learning together, let's help each other out. But yes, this is how I generally conduct my MURs. I'd say the wrong way to do an MUR would be to say to your patient, hey, so you find me the medication, take your medication, no problems, okay, done. That's not the way to do an MUR. You need to have a proper chat with them, delve into their lifestyle as well, any additional medication that they could be taking, really get a full picture of their health. And as I said, making sure that they are being compliant and adherent with their medication, and seeing if they are having any problems with it at all. For example, maybe they're experiencing a side effect which they didn't realize was actually a side effect of one of their medicines. So enjoy the role play, and the way that I like to start off all of my MURs is firstly by introducing myself. So I will say something along the lines of, hi, my name is Sureena and I will be your pharmacist today, and then taking them into the consultation room and undergoing the MUR. At the end of this role play, I will then go over why I ask specific questions and delve in, and we'll we'll break down the role play a little bit more, and like I said, go into why I ask particular questions and why particular things need to be done during the MUR. So I hope you enjoy it, and let's use our imaginations a little bit and pretend that my patient has been taking codidromol and lansoprazole for the last 3 months. They're a regular patient in my pharmacy, and they've recently been put on Hux D3 as well. So yeah, let's use our imaginations a little bit and enjoy this role play. Hello, Mr. Joshua Clement, is it?
Yes.
Wonderful. And can I confirm your address, please?
My address is 1D Avenue.
Wonderful. So the purpose of today's consultation is a medicine checkup.
Okay.
It's something we like to do annually with our patients to check how you're getting on with your medication, and it gives you an opportunity to ask any questions or queries that you may have.
Yes.
So before we begin, I will need you to sign this consent form. It explains that anything that you say today remains confidential between us, your GP, and any member of the NHS team that can provide you with the best care.
Okay.
So if you're happy to read the following points and then sign it when you're finished.
Thank you.
Excellent. So I can see that from your prescription you're on 3 regular medication.
Yes.
So we're going to go through each one in turn. If you tell me what condition you're taking them for and what time of day you take them.
Yes.
So we start off with your lansoprazole tablets.
Yes.
So what condition are you taking these for?
I take them for the acid in my stomach.
Okay, no problem. And what time of day do you usually take them?
I normally take them in the morning.
In the morning. Before food, after food?
After food, after breakfast.
Fine. So with these particular ones, they're actually best taken at least half an hour to an hour before food.
Okay.
That's how they work better in the system, providing
Yes.
protection in the stomach. So what time of day do you usually have breakfast on average?
I normally have breakfast at about 10 a.m.
Okay, and what time do you usually wake up?
About 8 to 8:30.
Fine. So if you take these as soon as you wake up, at least this is giving you plenty of time before you have breakfast. So then, like I said, it will work more efficiently within your system.
Okay.
Wonderful. So I can also see that you're on these codidromol tablets.
Yes.
So what condition are you taking these for?
That's just for pain relief
Okay.
for my knee. I messed up my knee a while back, and it's literally just for the pain relief.
Okay, no problem. And are you finding that they're helping?
Yes, they
Yeah.
are, definitely.
That's good. How often are you finding that you need to take them?
As and when I need them, really. It's either twice a day or it's 4 times a day, just whenever I need them.
Okay, so just to give you a bit more information about the codidromol tablets, there's 2 main active ingredients. One's called dihydrocodeine,
Yes.
the other one is paracetamol. Some patients find that with the dihydrocodeine, it can be a little bit constipating and it can make them a little bit drowsy.
Okay.
Because this contains paracetamol, if you find that on those days when your knee is really painful, you're taking these 2-4 times a day, so the maximum dose, it is recommended to not then take any other paracetamol containing products. And also these ones are best taken either with or after food.
Okay.
Wonderful. And I can also see that you're taking vitamin D.
Yes.
So did you have a blood test recently?
I had one about a month ago today.
Okay, fine. And I'm guessing that they found that your vitamin D levels are quite low then?
Yes, they did, yeah.
Okay, and how often are you taking these?
I take it once a week, every Friday.
Okay, fine. And what time of day do you tend to take them?
Whenever I remember, really.
Fine. So with these particular vitamin D, or vitamin D in general actually, they're best taken with the biggest meal that you have in the day. So for most people, that tends to be their evening meal, their dinner. So if you take it after then, as I said, these, because they're known as fat-soluble vitamins,
Yes.
they absorb better in the system after a bigger meal.
Okay.
So whether that for you be your lunch or your breakfast or your dinner, whichever is the biggest, try and take it then. Do you eat fish?
Yes, I do.
Okay, so even sardines, mackerel, again,
Okay.
these are quite high in vitamin D.
Yeah.
I mean, in this country in particular, our main source of vitamin D is the sun. But obviously we don't see the sun very often here, so lots of people are deficient in vitamin D. Are you due for a blood test again anytime soon?
I will be in about 2 months.
Okay, fine, wonderful. So I'm sure after that they'll then assess you and check if you need to carry on taking them or adjust your dose accordingly.
Yes.
So speaking more of your diet and your lifestyle, exercise in general, how much exercise are you getting per week?
I try to exercise at least 3 times a week.
Okay.
Whether that be playing badminton once a week or playing football with my friends.
Yeah.
Or just using my treadmill at home, at least 2 to 3 times a week.
That sounds very good. What's usually recommended is that we get at least half an hour exercise for 5 days.
Okay.
So you're working towards that, so that sounds very good. What about your diet? How's your diet in general?
I would say my diet is fairly balanced.
Okay, that's good to hear. Are you getting enough fruit and vegetables?
Not as much as I should be.
Okay. No problem at all. Again, it's recommended that we have at least 5 portions of fruit or vegetables a day.
Okay.
Particularly because you're low in vitamin D as well. There's a lot of vitamins and nutrients that we can get from fruits and vegetables. So when you can, try and start incorporating that into your diet a bit more.
That's fair.
And do you drink alcohol?
Yes, I do.
Okay, and on a weekly basis, on average, how much alcohol do you drink?
It's not something I drink every day. It's when I'm out with my friends on a Friday after work, it'll be 3 or 4 pints.
Okay, so what the NHS are recommending is that we have a maximum of 14 units of alcohol a week, but this should be spread across 3 days. So to put that into perspective, something like half a pint of beer is 1 unit. So it's not recommended to have then 14 half pints of beer in one night. As I mentioned, spread across 3 days is the recommended amount. Excellent. So is there any other medication that you take at all?
No.
Nothing else that you buy or purchase over the counter?
No.
Any other multivitamins? Any inhalers?
No.
Any creams?
Yes, I use a steroid-based cream. I've forgotten the name of it. It begins with E.
Okay, no problem. And what condition are you using that for?
It's when my eczema flares up.
No problem. You said it begins with E. Is it Humavate by any chance?
Yes, that's the one.
Okay, fine. So, because it is a steroid-based cream, it is recommended that only a very thin amount is applied when you do use it.
Okay.
Do you have any other questions or queries at all?
No, that's fine. Thank you.
Wonderful. So that concludes today's consultation. Our number is on the label, so if you ever have any questions or queries, please feel free to give us a call or pop in anytime. Based on this role play, let's break it down a little bit. So first and foremost, we need to make sure that it is the right person that we're talking to. This is the right patient. So confirm their name and their address and or their date of birth. We also need to make sure that we get written consent from them. That yes, the conversation that we're having with them today will remain confidential, but if need be, we might need to inform their GP of this conversation or anyone else in the healthcare sector that we feel will then provide benefit to their health. So say, for example, if a patient was experiencing a side effect, say they were on Ramipril tablets and they were complaining of a dry cough, not realising the cause of it was the Ramipril tablets, we would then need to tell their GP about that and inform their GP of that. So it's really important the patient does understand that other members of the healthcare team might be informed of the conversation that we're having today and that we get written consent for that. Now, with this case, this patient was taking medication that was dependent on food. And when it comes to medicines that either need to be taken before or after food, it's really important to have a conversation with our patients about when that will fit best into their lifestyle. There's no point in them saying to you that they wake up at 8 o'clock in the morning and you say to them, okay, take your lansoprazole capsules at 7 in the morning, because that might be of an inconvenience to them. So it's about having a conversation, working together to figure out when it would work best in their lifestyle and in their routine. Provide more information about the tablets. So for example, how does it work in the body? How does it affect the body? Remember, it's not just about making sure our patients are compliant and adherent, it's also about educating our patients as well, making sure they fully understand why they're taking their medication, what is in their medication, and what potentially they should avoid. So if a person is, say, on simvastatin or amlodipine, they need to make sure they avoid grapefruit juice, and this might be something that they weren't aware of earlier. So making sure that we do give them those extra counselling points and just educate them when we can. So lifestyle questions is an important aspect in the medicine use review. So what it can be included in that is, for example, asking questions on diet, exercise, weight management, alcohol, sexual health. Now, not all of these will be appropriate for a consultation, so use your judgment. Maybe pick out a few. It might be that maybe all of these are appropriate, but usually in most cases, diet and exercise I find is the most appropriate, but you might find that actually alcohol consumption, weight management, smoking cessation, sexual health, they can all be appropriate too. So you need to tailor each MUR to each specific patient that is sitting in front of you. Now, And also don't be afraid to delve a little deeper, because a lot of people like to kid themselves into thinking that they're actually really healthy. But when you delve and you find out actually they're not drinking as much water as they should, or maybe they're not having as much fruit or veg as they should be doing, or they're maybe drinking a little bit too much and they didn't realize, asking those lifestyle questions gives a big picture on actually how a patient's health is and what they can do to try and benefit their health. So, for example, if they're on cholesterol tablets and blood pressure tablets, it's about stressing the importance of diet and exercise to bring that cholesterol down, to bring that blood pressure down. And if they don't, then the impact that that will have on their health later on. So again, going back to educating our patients. And if you are going to talk about, for example, something like alcohol consumption, put it into context. There's no point saying to your patients, the NHS recommend that you drink 14 units per week and leaving it at that, because they might not understand what does that mean. So if it's beers that they're drinking, put it into context of beers. If it's wine that they drink, put it into context of wine. If it's shots that they have, put it into context of shots. So trying to really make them understand, what does that 14 units actually mean. And for example, if you have someone who smokes and through the MUR you discover that they are a smoker and that they're thinking of quitting smoking, this is prime opportunity for you to then offer them a smoking cessation if that is a service that you provide in your pharmacy. So again, looking at the bigger picture of their health and how us as a pharmacy team can benefit them and support them into making better changes. So when asking and questioning patients, do you take any other regular medication? You might find that actually they think other regular medication means tablets or capsules that the doctor has prescribed, without realizing that medication that they might buy over the counter, inhalers, creams like steroid-based creams, herbal products, multivitamins, this can all be included as other medication. So it is an idea to go through each one in turn explicitly, asking them, do you take X, Y, Z? Do you use a steroid-based cream? Do you use an inhaler? Do you buy herbal products? What I find that a lot of patients will end up saying is, yes, I'm taking a multivitamin, or yes, I'm taking omega-3 capsules. So again, it's getting this bigger idea of what it is that they're taking, and you might actually find that, say they're taking a herbal product, this could potentially interact with one of their regular medicines. So make sure that you do go explicitly through a list of what other medication or other multivitamins they might be taking, and make sure to jot that down in their notes too. And when concluding an MUR, make sure to leave the door open for them to ask you any questions or queries that they might think later on down the line. At that moment when they're sitting in front of you, they might say, no, I don't have any other questions. But when they go home, they might want a little bit more detail about something, or they want a little bit of reassurance on something that you've said. So make sure you always leave the door open. Let them know that your phone number is on the labels, that they can contact you anytime, and that they're more than welcome to come into the pharmacy and have a sit down and a chat with you, making sure that your patients know that you are accessible and that you are there to support them with their health queries and questions, and that they can turn to you as a trusted pharmacist. And I want to say a big thank you to this random stranger who agreed to be in my video. He's got a pretty face. And if they like this video, what should they do?
Thumbs up, share it, and subscribe to it.
And also check out my Facebook, Instagram, and Twitter, where I do upload extra information and material. And until next time, happy revising!
Take 52! Bring it on! Okay.
You okay now? You ready now?
I'm good.
Okay.
Okay, let's go.
Right, so I'd like to check up how you're using your medicines and how you take off.
What? Okay, don't take me seriously. I'm trying my absolute best.
Okay.
I messed up.
You're just so pretty. Is it? No, that's not what it is.